Public comment.
I think I can call it to order? Because the green light means it's on, right? Welcome, everyone. We're going to call a meeting to order. I'm Astrid Hager, one of the commissioners and the chair of this committee. We would like to have the roll call, and I think, Linda, if I'm correct, we'd like to do the virtual first or the second.
We'll do the roll call for everyone and then I'll get in.
Okay, so can we, first, we're going to have the roll call, but do we want to do the ground rules for the meeting after the roll call?
Yes, thank you. Robert Byrd. Summer McBride. Marcela Ramirez.
Here.
Carol Segala. Deborah Allen.
Here.
Jacqueline McCroskey.
Here.
Deanne Tilton.
Here.
And Astrid Hager.
Here.
Quorum is present. And before we do begin today's meeting, I do want to cover our ground rules for the meeting. And just as a threshold matter, under AB 2449, we are able to conduct this meeting virtually as well, that allows board members to participate in person from a physical single location without identifying their location. Now, if the physical attendance quorum is met, then AB 2449, as I mentioned, does permit the board men to join virtually without notice of their location under two circumstances. The first is for just cause, and the second is due to emergency circumstances. Both just cause and emergency circumstances are defined under the statute. Regarding public comments, remote attendees can submit public comments in two ways. The first way is written public comments must be submitted in advance of the meeting. They can be emailed to myself at lvo@first5la.org by 1:30 p.m. the day of the meeting in order for them to be read aloud during the meeting. And as a reminder, public comments emailed should indicate the item number the comment corresponds with. Any public comments received after 1:30 p.m. will become a part of public records. Now, during the meeting, public members can also use the Q&A chat function to express an interest in speaking to an item. It is important that these requests to speak be submitted via the Q&A chat box before the item is presented. And when submitting requests to speak, public members are asked to only provide his or her name and the item number the comment corresponds with. All public comments received during the meeting via the Q&A chat will be addressed in the order they are received. And when you do hear your name being called to provide public comments, you will be given the ability to speak during the meeting. And we will call your name twice before moving on to the next public comment. Just a reminder that 2 minutes are allotted for each public comment. And once the 2 minutes have passed, we will move on to the next public comment. Now, for all in-person public comments, all speakers are asked to complete a public comment form in front of the lobby in order for them to be addressed and for them to be submitted prior to the item is presented. You too will also be given 2 minutes for your comment. And once the timer does go off, we do respectfully ask that you step down from the podium. All public comments in person will be done at this podium on the left-hand side right here. If there are any questions during the meeting, please feel free to come to me and I will provide the support that we can or direct you to the person who can provide the support. And with that, I'll hand this back to our committee chair, Astrid Hager.
Moving on to the next item, are there any commissioners who are requesting the committee's approval to remotely participate in today's special meeting due to a physical or family medical emergency that prevents them from attending in person?
Yes, there is. Dr. Robert Byrd is joining this meeting virtually under AB 2449.
There's a question of whether Commissioner Byrd participated remotely in the commission's meetings under AB 2449 for either just cause or because of emergency circumstances at least twice this calendar year.
Confirming that he has not attended more than twice in this calendar year under AB 2449.
Commissioner Byrd, can you proceed with a brief description of your justified reason under AB 2449?
I'm recovering from COVID. I was exposed to COVID and tested positive for COVID.
There's two thank yous here. Thank you for not exposing us all to COVID. And thank you for that description, Commissioner Byrd, regarding your need to participate remotely during today's special meeting under AB 2449. I think everybody in the room is grateful to your considering our well-being. So the next item is item 3. And it is to review the program and the planning committee transcript from February 23, 2023 meeting. I think we all have that as part of our handout, don't we?
Yes, and if there aren't any additions or changes to the transcript, then we can receive and file these notes.
Item 4 is a informational discussion that's going to be provided to us from some of the stellar members of the First Five staff that we just met with. That was awesome, by the way. On the early identification intervention on Help Me Grow ALA Learning and Evolution. I appreciate hearing from the three of you. And I didn't you think that the noon meeting was amazing, that we got to know each other a little bit better? I appreciated that very much. I look forward to this.
And if I may, before the health systems begins, I wanted to confirm for the record that there are no public comments for item 3.
All right, I think I Can get started. Well, appreciate the use of the word stellar, Commissioner Hager. So good afternoon, commissioners, First 5 LA staff, members of the public. My name is Tara Fitzik. I'm with the Health Systems team. I'm joined today by my colleague Zuli Howdigi and Steve Baldwin, who's representing LA County Department of Public Health. We are thrilled to be here in person nonetheless, to spotlight all of the learning that has surfaced through our Help Me Grow LA efforts. Also talk about how that work is evolving, informed by changes in the broader landscape. And I want to share that the three of us, just so you know, have been working together on Help Me Grow LA since 2019. For me specifically, I've been a part of the work since 2017, Steve since 2018, Zuli since 2019. In summary, you have a very seasoned panel here today. So with that in mind, let's get started. So we have, next slide, we have 3 primary objectives we are hoping to achieve over the next hour. Should I wait for the slide or? Oh, it's me. Thank you. Oh. First, we're going to offer a brief history and overview of Help Me Grow LA, including how the context has shifted in the last several years within the broader field of early. Next, we're going to take a deep dive into the learning that has surfaced through Help Me Grow LA. And finally, we're going to explore how this learning and this part of the presentation we want to hear from you, that latter part directly from you, how can this learning inform our strategic plan reset? All right, so the next several slides, as I mentioned, are going to provide that overview of Help Me Grow LA, including its history, our partners, our key strategies. So we're all holding a shared foundation. This slide is an important starting point as it defines the problem within early identification and intervention presented through quantitative data, but the problem that Help Me Grow LA is working to solve. It articulates our why. And as you can see, this includes the presence of delays in children, that 1 in 6 on the left, as well as how we're doing in California. We also call out the disparities within EII tied to access for children of color in comparison to their white counterparts. And we essentially conclude with our problem statement. Children with a developmental concern may not be connected early enough or at all to appropriate services and supports. I want to call out a fun fact within this slide. In 2018, right around the time when we launched Help Me Grow, California was ranked 43rd with 21% of children, California children receiving a timely developmental screening. So we have made progress as a state. We can perhaps talk about how and why and what was contributing to that, but just so you know, we went from 43rd to 31st in 5 years. All right, moving on next. Holding that problem statement and data, Help Me Grow LA was initiated with its primary goal to promote collaboration across sectors or systems to strengthen early screening of developmental and behavioral delays for all young children and ensure connection to appropriate services and supports. A county-wide planning process was launched in 2017 with many stakeholders to figure out how do we apply the national Help Me Grow model to LA County. LA County Department of Public Health joined us as our co-lead in 2018. Multiple partnerships were initiated soon after with various strategies launching at various points. Our advisory councils and our parent council launching in 2019 and then 2020. Our community-based work, also known as Pathways, began in 2020 as well. Our LA Care partnership in 21, and then our centralized access point in 2022. We're all going to get into that in a little bit later in this presentation. And while we didn't launch with a direct intentional focus on the healthcare delivery system, that did receive greater emphasis over this last several years, as there was a growing understanding of healthcare delivery holding an early and prominent role in addressing children's early identification and intervention needs. And when we think about healthcare delivery, we think about that broadly. So we think about systems that directly deliver early identification, intervention, including health plans, clinics and providers, developmental disability services, mental and behavioral health, and then school districts. Help Me Grow LA is anchored in collaboration. Its success is dependent upon our partnership with many of the key organizations and systems that you'll see here at the bottom of the slide. Next slide. Moving on, we have the Help Me Grow model. It is organized through 4 core components. As you can see on the left with the purple, the centralized access point, the family and community engagement, child health provider outreach, and then data. The primary purpose of each component is described in detail on the right side of the slide. Important to note is these 4 core components are interconnected and reinforcing, so that activity happening in one area is influencing and informing another. For example, engaging with families to gather important insight and experience then informs how child healthcare providers can better serve and support families in connecting. All right, Help Me Grow LA specifically. So then we took that model and what does it look like here in LA County? The specific strategies and activities that make up each core component are included here, beginning with our CAP, or centralized access point, includes a call center, a website, and a resource liaison support led by LA County Department of Public Health. Our Community and Family Engagement Council and Pathways is part of our community and family engagement component. Our partnership with LA Care Health Plan fulfills our child health provider outreach and engagement efforts. And finally, data collection and analysis, including evaluation, occurs within all components to capture progress, learning, and inform continuous quality improvement. You now have a refresher. You are now experts in all things Help Me Grow LA. We'll close, you're getting there. But you now have the why, our problem statement, the what, the model, and how, the strategies at a high level of what Help Me Grow LA looks like. And while we're going to go even deeper within these core areas and share important progress, learning and highlight state, we wanted to first walk you through a lot has changed in the context of early identification and intervention since we launched Help Me Grow back in 2017. So for the last several years, we have experienced enormous change. I don't think I need to say that out loud, but I just did. We've captured the most significant here, acknowledging some of these shifts and their implications for early identification and intervention are still unknown, but hold a lot of potential. Beginning with the COVID pandemic, elevating the disastrous impact it had on children's access to preventive pediatric care. As we know, well baby child appointments dramatically decreased, which offer important engagement between families and providers and where the screening, surveillance, and developmental conversations take place. While these services are coming back, a lot of catch up needs to happen. And while you can catch up on immunizations, it's much more complicated to catch up on developmental screening and monitoring and linkage to services. These services are coming back and we're tracking and seeing the differences there with utilization. But additionally, we know the pandemic had a disproportionate impact on children and their families, with children of color experiencing greater barriers to access timely pediatric services and supports. The pandemic also brought increased need for mental health supports, yet services for children are lagging as the system struggles to support young children, given their focus on school-age children and lack of training, expertise, and serving young children and their caregivers. Within Medi-Cal, major transformation is underway, beginning several years back with Prop 56 incentive payments put into place. This did not exist before the launch of Help Me Grow and was a major game changer. Finally, we had a unique incentive payment just for the developmental screen that providers can now access. Providers and clinics can bill for an additional payment for completing a developmental screen. In addition, there's increased accountability and performance measures are now coming through for Medi-Cal managed care plans. Previously, developmental screening was not a measure that had a performance target. That changed at the end of last year. With this year, 2023, serving as the first year, health plans will be tracking and measuring if developmental screenings are taking place in provider and clinic settings. And finally, through CalAIM, which is a statewide effort to transform Medi-Cal and new benefits such as dyadic care and support for an expanded workforce through community health workers. All of these hold promise for greater focus and resources that can be directed to support promotion of early developmental health, including screening and linkage to services. While all of these changes were happening in Medi-Cal, historic shifts were also underway for the Department of Developmental Services. Some highlights we included here are eligibility expansion for early start, Also, FASD was added as a risk factor for which an infant and toddler may require early intervention. And we also acknowledge that this will allow more children under age 3 with delays to access this critical support. There also was increased workforce benefiting young children with a reduced coordinator to consumer caseload, and now specialists being available at each regional center knowledgeable about early intervention federal requirements. We hope this offered important background and context for understanding how things are shifting within EII. The next section, we're going to take a deeper dive into what we're learning from Help Me Grow LA's implementation, and when possible, connect it back to this context. And I'm going to pass it to Steve with Department of Public Health, who's going to start us with the centralized access point.
Thank you, Tara, for that. Good afternoon, everyone. Feels kind of old school being in the same room with you all. But it's refreshing to see live faces and instead of on a screen. So good to be here and happy to share about the centralized access point. Actually, did you steal the remote?
I stole it.
Oh, thank you. Got it. Well, so first off, from the outside looking in, the centralized access point, we refer to it as our CAP, the CAP, centralized access point, is a website and a call center that provides resources and linkages to people, mostly families, and sometimes child health providers on child development. However, the CAP is really sort of like an iceberg. What you see on the surface, the website and the phone number, is really representative of a tiny percentage of the overall work that goes into the CAP effort. What you don't see as easily lies beneath the surface, and really is the most important part of the CAP, and that is the team of dedicated staff whose job it is to outreach, to assist families that have questions or concerns about their child's development, who have invested literally hundreds of hours on training, on practice, on resource curation and development, on developing workflows with partners, on developing call guides and scripts, on outreaching to partners, doing presentations, promotion, and just thinking about how to improve this platform and these tools that we've developed to work with families. Hopefully everyone in the room has been to our website. If you haven't yet, I encourage you to go to helpmegrowla.org. It's in your slides and on the screen. And you have our phone number there as well, 833-903-3972. You can call and talk to a live person and get help on child development resources and linkages to community connections. So there's a couple of, in addition to helping families, there's a couple of more practical highlights that we wanted to share today. And number one is the Regional Center Service Locator tool that we've built as part of our website. It's a simple online tool that allows the user to enter any LA County physical address. It's linked to the back-end library of all of the physical addresses in the county. And when you do that, the results will show the linked regional center and family resource center to that address. It seems like a simple task, but it actually requires multiple back-end database cross-referencing with county databases. And our tool does it automatically, hyper accurately, and really fast. It's really a great tool. And so again, you can go there on our website, click the resources tab and find the service locator. Super easy. The other highlight I wanted to mention is our translation efforts for our materials. In partnership with First 5 LA and Help Me Grow LA partner LA Care, we were able to translate the Learn the Signs Act Early milestone trackers, of which there are many, into all 13 threshold languages in LA County. And about half of those are on our website now, and the other half will be available very soon. They're in process of translation. So really proud of that, and they're a great tool for anyone that's working in child development with families. Thank you, Tara. There are 4 learnings as well that I'd like to share today. So the first one is regarding our call volume and our client base that we've worked with. So between the day we launched, which is almost a year ago today, on May 17th, 2022, and our last data poll, which is about a month ago on March 23rd, there were 417 unique client records created in our database for the CAP. And this represents all the caregivers, parents, kids, providers, simple calls we handled, meaning just a quick question, anonymous callers, clients that filled out a form online that then we called back, any client we worked with, all non-test records. There are 417. We get a wide range of calls, some very quick that we call a simple call, others that are more in depth that we call a navigation call that includes a full intake where we provide resources and referrals for the family. And then callers from providers of all types, including those from medical providers, ECE providers, and childcare providers, et cetera. There are several slides at the end of the slide deck in the appendix that delve deeper into our client demographics and referral types, and I'm happy to discuss at the end of the presentation, or if you'd like to call me sometime and have another conversation about it, I'm happy to do that. In terms of the referrals provided, happy to report that 91% of the referrals of the families receiving a referral were for a child age 0 to 5. So really happy that we're hitting our demographic with the families that have young children. Of the referrals made, a little over half of them went to regional centers. About 54% are going to regional centers. The other half, about 46%, going to non-regional center partners, including family resource centers, family empowerment centers, home visiting, law centers, mental health, and school districts for either general needs or special education. We also follow up with families 2 to 3 weeks after the initial contact. And of those families we contacted, 52% of those families reported either having received services already or having had an appointment to receive services soon. So we feel that's a pretty good measure of quality in terms of the strength of the referrals that we're making as well. The second overall learning that I wanted to share is about the collection of race and ethnicity data and of building a culture of cultural humility on our team. And from the beginning, we built the CAP with data collection in mind, understanding that having data would help drive improvements of the program and the services that we provide. And through conversations with internal and external partners, we focused our continuous quality improvement efforts on improving the collection of our clients' self-reported race and ethnicity, since, of course, it's crucial to our health equity work. We focused on working with trusted partners to cultivate an approach to cultural humility and created a plan to engage partners to better help us understand how to tailor communications efforts that support and engage families, particularly those who reside in Black and Brown communities that have been historically marginalized. The third learning I wanted to discuss was, or mention, was sustainability. And sustainability in identifying long-term funding for the CAP has been a challenge. We've looked at utilizing match funds within the department. We've spoken with many local systems across the state of California and several statewide systems nationally. In California, the match for Help Me Grow systems in every county that we spoke with is provided by that county's local First Five affiliate. So as we continue to investigate long-term sustainability, we have to face the fiscal reality of sustainability with grant funding. So that said, there is an upside to this, and that has to do with the last bullet. And that is our pivot to regional peer navigation support. So I want to start by saying that DPH remains committed to EII and providing resources and supports for families and assisting families with tools for tracking their child's development while linking families to community connections. Our goal for the next year is to deepen our work with children and families with special needs. And as we look to do that, it's critical that we self-reflect and we do so with a continuous quality improvement lens. And we think about how to make our system work better than it is even today for families. Looking back at the numbers that I shared, that 417 clients served in the last year, that's about 1/3 of what we initially anticipated to serve in year one. And so we need to improve that. And in the coming year, to do that, we're looking to adjust the current structure of the CAP and shift towards a peer-led model where parents and caregivers with lived experience are housed regionally around the county in places that are convenient for clients to access. And a similar model has been implemented in our county in SPA 7 in support of a project called Early Needs Response for Infant and Child Project. The acronym is ENRICH. You may have heard of ENRICH, with great success. And it also mirrors a peer model called Family Ties in Massachusetts that we think we can utilize to build on the success of Help Me Grow LA. Our team has done really an outstanding job with outreach and engagement and training partners. And yet we haven't yet tapped into a deep vein of need that we know still exists in the county. And we think our peer-led approach, a regional approach, can serve as a connecting point for children with disabilities moving forward. We don't want to miss the opportunity we have before us to connect with the families that need help. And so our hope is to build on the structural assets that have been created for Help Me Grow and for the CAP, in particular, the website and the call line, while building a network of peer-led, regionally based supports for families and children with special needs. We feel this model will help support sustainability. We have full support of department leadership from the top down, and we believe it will be of great interest to potential funders in the coming year. So with that, I will pass it on to my friend Zuli.
Thank you, Steve. In the next 2 slides, I'll be reviewing highlights and learnings associated with our community family component, starting with the Community Family Engagement Council, CFEC for short, which is at the core of this approach. As one of 2 advisory councils for Help Me Grow LA, CFEC was launched in 2020 and is comprised of 12 parent and community champions for early identification and intervention to ensure that family perspective is at the center of everything that we do. They bring a variety of backgrounds and expertise, but each has a deep connection to EII through their work and advocacy with families, and in most cases through personal experience as a caregiver for a child with developmental delays or disabilities. They serve as strategic planning partners and advocates for Help Me Grow LA and advise on many aspects of implementation. One key learning for us was what it truly means to compensate folks adequately for their thought partnership, their guidance, and expertise. Building upon learnings of other efforts across First 5 LA and input from CFEC members themselves, we moved towards an opt-in honorarium system that reflects appropriate compensation needed for the true time and effort that it takes to fully participate in such a group. Something else that we like to highlight is how closely CFEC partnered with us to develop and vet communication and outreach materials. For example, CFEC was instrumental in reviewing the call script for the Help Me Grow call line that Steve just described. Additionally, CFEC member Lisa Scheuer co-presented with Help Me Grow LA staff at the American Association of Pediatrics Town Hall and at a recent LA Care conference to many providers on best practices for engaging families. This resulted in a development and distribution of a resource handout that has garnered interest from training institutions. Is my audio cutting out? No, okay, good. Another area that we're continuing to expand our learning is with recruitment. We acknowledge that the first recruitment efforts didn't yield representation that truly reflects the ethnic and racial geographic diversity of LA County. Founding members were fully aware of this and played a crucial role in identifying the need to expand the council, and were very thoughtful about and proactive about outreach, recruitment, and onboarding. Despite our current expansion, we're still working to strengthen inclusion of parents who currently have children age 0 to 5 that are accessing EII systems. Lastly, we want to spotlight the groups leaning into best practices for family engagement and lifting up family voice in our move to combine our 2 advisory groups into a newly formed leadership council comprised of both system leaders and community leaders at the same table, which is happening right now. Next slide, please. Right. Another major investment under community and family engagement component is Help Me Grow LA Pathways, which seeks to strengthen regional referral pathways and networks of local trusted providers through innovative technology, infrastructure, and practice change strategies. Work is still underway with the initial 5 grantees well into implementation of the first year, which will be ending this December, and 2 newer grantees that they're wrapping up the initial planning phase right now, and they're expected to go until June 2025. Learnings so far include the importance of recognizing the ecosystem in which technologies are introduced and implemented. In order for referrals to be easier for both families and staff, they need to be accompanied by sufficient training, workflow adjustments, and support. This requires getting input from external partners and working really closely with staff to make sure that what we're doing is actually supporting them and not adding an extra burden. An example of successfully implementing this new technology was via an online referral portal launched by Westside Regional Center last year. This investment reduced reliance on paper referrals, and now the majority of referrals are received online, streamlining the process and adding transparency for parents. In a parent survey to date, 95% of 908 respondents have found that the new online system is easy to navigate, and more than 300 parents have logged back in to review their application status. This innovation has caught the attention of other Help Me Grows and their respective regional centers across California who are looking to implement similar changes. Additionally, we know that strong partnerships and relationships are essential for fostering smooth referral pathways, and this relationship building requires investing time and resources that are often enhanced by formalizing agreements such as MOUs to help ensure collaboration continues to move forward with a shared understanding of definitions and goals. A sustainable outcome of Pathways projects are formal agreements and communications established between partners, many of which will outlast our current Pathways and as they continue to form partnerships throughout the region. This investment was built with sustainability in mind, and we're learning more about the extent of this impact and sustainability success. Core aspects of the work, such as MOUs and technology improvements like the examples that I mentioned earlier, can be sustained because they were addressed with a one-time enhancement and investments. Other aspects of the work require ongoing funding and planning, which is underway this year, in addition to data collection and program evaluation. Slide. And this next Help Me Grow component is child health provider outreach, of which LA Care Partnership is our main investment. This 4-year partnership with LA Care began in January 2021 with the objectives to integrate early identification and intervention protocols into 10 practices workflows. And secondly, to increase awareness and education of developmental screenings and milestones with providers, care teams, families, and caregivers. Practice transformation has begun with 7 out of the 10 planned pediatric clinics since December 2021. The remaining cohort of 3 clinics will be recruited later this year. We have preliminary findings from the first cohort, and they have shown an increase of developmental screening rates from 14% baseline to 26% as of last month, and that is an 85% improvement. Additionally, with this pilot, LA Care has been successful in leveraging resources such as their community centers and extensive training and communication platforms to expand the reach to providers and families with a more direct focus on early childhood health and development. This includes holding children's health conferences for providers through their continuing medical education events. LA Care also leverages their community resource centers, which serves local families, not just their members, to provide resources to the community, such as free child development classes. And lastly, this partnership makes use of LA Care's expansive reach to providers and families through various communication platforms to have more direct focus on EII supports and information. This includes a robust social media campaign promoting child development milestones and resources at LA Care. I'm sorry. We are also taking steps in the data collection and analysis component. Both LA Care and Pathways have their own dedicated evaluation program evaluations, which are currently underway. And we have convened a data and evaluation work group in which First 5 LA, Department of Public Health staff, we partner with our leadership council members to prioritize outcomes, develop a logic model, and to help make sense of the data arising for our investments for in the future to inform recommendations and possible sustainability strategies. Now, spanning across all components of Help Me Grow LA has been a deliberate focus on equity, which has gained momentum this past year. Families often experience EII services differently based on characteristics such as race, ethnicity, geography, language, etc., due to structural racism and marginalization. Without intentional effort, EII systems can continue to reinforce these inequities. And as you heard, since the pandemic, these disparities are deepening. While equity has been a consideration since early on in Help Me Grow planning, an essential learning has been the importance of developing a structured equity planning process, which centers on lived experience of communities impacted by historical barriers to accessing EII services. This plan uses a targeted universal approach, which includes identifying overarching or universal goals around EII, combined with targeted strategies to achieve more equitable outcomes in communities that have historically faced greater disparities. Over the next year, we will be focusing on equity planning with our initial priority population, Black and African American families, which was identified based on data and historical context. Work is underway through the formation of an equity work group comprised of staff members and members of the community who will help guide community listening sessions, planning, and strategy recommendations over time. As First 5 LA progresses into our strategic plan reset, our hope is that these learnings from the equity listening sessions will inform broader strategy development in the future, ensuring that equity considerations and community voice remain at the core. And now I will pass this on to Tara, who will review our overarching themes of what we've learned so far from Help Me Grow LA implementation, leading us to strategic plan reset.
All right, so you just heard the lessons learned at the activity or project level. Now we want to level it up to think about what are the key themes that can inform our strategic plan reset and our priorities going forward. So starting with the time it takes to do this work, planning, launching, figuring out sustainability for a countywide systems change effort was extremely ambitious, and to do this in 5 years. Developing the necessary partnerships focused on a shared understanding of the problem and solutions take time. Contracting with complex systems like managed care plans was a big lift, new territory for First 5 LA. The time it takes to do this work is important for First 5 LA to consider as we remain committed to systems change, yet know we want to more clearly define our targets and to be held accountable to them. Second item, when Help Me Grow launched a little over 5 years ago, our focus was on all children. And while we emphasized cultural competency within EII spaces and supports, we were not equity driven. Focused on understanding the disparities. As First 5 LA started moving through its equity journey, and our partner, LA County DPH, put a stake in the ground around prioritizing health equity, we started taking a closer look at root cause, unpacking how structural racism shows up in EII and how that manifests in greater barriers to access, differing quality and experience, lack of culturally congruent workforce, and much more for children of color and their families. This last year, we committed to prioritizing, as you just heard Zuli say, historically marginalized communities with a focus on Black African American children and their families. And also, we are in the process of figuring this out. We're building an equity plan. We're launching the listening series, again, Zuli just mentioned, to hear directly from Black African American families on their experiences in EII. And lastly, as we center parents and their expertise and perspective in our work, how do we move from parents as advisors to serving as our co-leads? We've had conversations about decision rights and who makes the final call. I cannot say we've resolved that, but we're having conversations about it. We've largely stayed in the parents provide us feedback space, but there's an emerging understanding that if we are to be successful, we have to figure out how to share power with parents and how to do this work very differently. And we're still very much working on that and figuring this out. And as Zuli mentioned early in her presentation, we are bringing together our advisory councils and moving that to a leadership body and bringing together systems leaders with parents at one table. All of these higher level themes offer important learning to inform our strategic plan reset. We imagine you have some thoughts surfacing now as you process all of this information, and we would love to hear from you. So imagining you have some clarifying questions, bring those up as well. But given all of the learning that we shared here today, where do you see opportunities or challenges that should inform the strategic plan reset?
So I just have a somewhat simple, maybe not so simple question to begin with. Will the evaluation cover beyond screening to access availability of needed resources, parent follow through in terms of, sort of I don't even want to say completing care plans, but like how parents feel about them?
Mm-hmm.
Will you be able to get to some of that and more the flavor of kind of what it means to families?
So right now we have evaluations across within various components. So LA Care has an our LA Care partnership has an evaluation, the Pathways Initiative, which is the community-based collaborative projects. There's an evaluation for that. DPH does a lot of, data review analysis for the centralized access point. We haven't yet done a comprehensive Help Me Grow LA evaluation, as we were holding and pausing for all of the strands to get up and going, and also understanding, as you heard, what shifts were underway as the work was evolving. But that is planned for 22, 23. And so within some of the components, in particular Pathways, which is about coordinating and collaborating and connecting local agencies to strengthen referral pathways, there are components of, yes, linkage to services and supports, not just the screening.
I think when we get that
The timing.
stages, but that would really help with the reset, right? To understand.
Yes,
what-
we wish we had it
what's
now.
there And yeah.
We'll have it next
how we
year.
Could really build on existing capacity.
I know the timing is challenging. But yes, there will be a lot of evaluating happening over this next year. And we are going through reset now,
Yeah.
as you all know.
Yep.
So to the degree that, yes, that's why kind of the conversation
Mhm.
today, let's highlight the learning to date. And, figure out, or as we're learning from those evaluations, how can they continue to inform our work?
I can also add that in our individual programs, such as in Pathways, we really do value, and there's an intentionality feedback on what the parent experience has been like. And so, I mean, we have some initial findings already. I think I shared a few data points about Westside Regional Center and the parent experience. So that's very much built in to their evaluation.
That's good.
Can I ask a question, Tara? I think speaking medically, I understand the requirement and the request that every child gets a developmental screening. It's been my experience that has rarely happened, that every child gets a developmental screen. There are boxes that are checked off, and it's just been that doesn't happen. So a lot of the kids that need the screening are not getting it because it's easier to not do it and say you did it. And so that would be a point, I think, in terms of checking up on those kids in terms of somewhere the access point should be not just through their private pediatrician or their pediatric provider, because they're not always doing the job that they should have. The other thing about access, which I always say, is access is great, but you have to have access to quality care. And that's something that we haven't really done a good assessment of in terms of quality. And one of the guidelines could be, are they actually doing developmentals, and are the families getting the services they need? I think we talked earlier about the idea of screening kids for ACEs, but not actually providing any services that would perhaps deal with those adverse childhood experiences, because we're being paid to do the screening, but not to do the treatment. So I mean, that might be an important aspect of looking at this. And I think that one of the huge gaps in all of this is having access across the board to mental health services that are easy to get to and of high quality. And looking at that, I think although I'm good friends with all of the leaders at LA Care, they've not always been great trendsetters in delivering mental health services to the population of children that they have signed up. And I think that's something that we could hold them accountable for, and probably should do. And I agree with Commissioner Mikrowski that we need to have data on how many kids actually access the services. I think it's great to have an access point. And I think last time we met in small groups, we talked about what divisions of services in the county would be a really good place to hang access. And I think one of the things that was discussed was the idea of putting it into local schools in terms of improving physical access to services, because a lot of people that we're taking care of that are underserved don't have the means or the vehicle to access through data points, et cetera. So having them be able to walk to access might help and improve outcomes. So I don't want to cast dispersion on my fellow pediatricians, but there are days when you have to do that.
If I can follow up on the last two comments, I wanted to make a comment and ask a question, but I'll start with the question because it's most directly related. And that's what have we done about the 48% of callers that you mentioned for whom there isn't a positive referral? Because even short of a formal evaluation, that would be a good source of information about what's missing in the system or what we could be doing better. So I want to know the answer to that. And maybe I'll give you a chance to answer, and then I'll make my comment.
Yeah, so you're referencing we had 52% of clients that said that they had that received services or had an appointment to receive. So then there's 48% who hadn't yet. I would have to do more data digging on that, but that could be that some percentage of those don't have an appointment. They're still waiting. We continue to follow up after that initial connection. Our resource liaisons don't just give up on the client at all. They continue to follow up and help and support. If the first round of referrals are less helpful or don't follow up with the client, we will intervene and call on their behalf or find a different service provider. But I can do some more data mining and see what those barriers are.
I think that would be great. I mean, I don't think we need a formal evaluation to at least take advantage of the information that's at hand. The thing I wanted to mention in response to the points that are being made about the need for services. I mean, screening is wonderful and we need to do 100% of kids, but if the 34% who are getting screened aren't getting anything after they're screened, not much use. And so I think on the one hand, we need to be assured that all kids are but I think part of the reason not all pediatricians do it is they don't know where to refer kids if they have a positive screen. I think that's, it's not a big incentive to keep asking people tough questions. And one of the things, having seen the two examples that Steve gave of a model that's peer-led, both here and in Massachusetts, is that I think having peers given adequate support and training, they can serve as a first rung. I mean, they can do more than just make a referral and pass the family on. They can engage with the family in other ways through coaching, training, ongoing support, connecting them to other families. So I think there's a lot of opportunity to build a richer system with a kind of first level of preventive, if you will, support services. Because, I mean, if every kid who got mental health services, if every kid who needed mental health services were referred, the system would be overwhelmed. There just isn't enough, there aren't enough resources out there. So we got to figure out some interim ways while we develop a new cadre of mental health providers to be responding to the need. We can't just, say, forget it.
I have a question. Thank you for this presentation. I'm looking at the appendix and the data that's provided there about the self-identified race and ethnicity that's being served, the spas and the concerns that are presented. Is there data related to, and this may be a little bit harder to gather because you're getting the data from the people who have actually reached out to access the services, but data related to stigma in the community for families who may not want to access the services for fear that their child will receive a label or be diagnosed with a developmental delay, and the trajectory that may put them on if they're not able to access the services at that point, or even once they're entering public school and they know that there are limited funds for students with special needs or developmental delays, and also the disproportionate numbers of Black families who are identified as having developmental delays, and what that does for their child, but also what that may expose a family to who may see that as something that they caused, because there is a level of guilt with families who feel like, what did I do wrong? And will this expose me or open me to some risk with my family now being sort of interrogated?
Mhm. I mean, I think about your question in connection to Dr. Allen's question and comment. So yeah, why are what's going on with the 48% that haven't followed through? Is there potentially something contributing? Is stigma a part of that? What's going on with the family? We talked a lot about stigma, addressing stigma, minimizing, normalizing kind of early childhood milestones and development. As we were launching and designing Help Me Grow. And a lot of that has been done then through promotion, educational opportunities, and going that direction. I mean, I don't know, maybe you guys have exact examples of where we're collecting to get a sense of where there's stigma or concerns or that reaction at the individual family, but we've also tried to move away from thinking about stigma and associating with it, putting the blame on parents, right? Or putting the overemphasis on what's going on and moving away from that kind of frame of stigma. So that's been a lot of the conversation as we continue to build out the educational materials and the resources, and how do we best work with and support parents? I don't know.
I think there's also a real opportunity with our listening sessions to get a better understanding of like those really complex dimensions behind stigma. As Tara mentioned, really being careful about not placing the blame on the parent or like kind of further perpetuating that framing. So we could get some really helpful insights in, for example, how to tailor our messaging and our media campaign, for example, and communications efforts based on that information.
Thank you for your report. I had a question about just your emerging learning. You mentioned that you're learning about parents and caregivers and their perspectives, and have had some conversations around who makes the final decisions, and you're grappling through all of that. Can you speak a little bit more to that and elaborate a little bit more about what you've learned in that area?
Sure. You wanna?
I'm sorry, I didn't catch that last part. Maybe.
Oh, what we're learning around kind of parent engagement and that work, and how we're pivoting and shifting and centering parents in a different way and figuring out how to co-lead with parents.
Yeah. As Tara mentioned, a lot of our work with our Community Family Engagement Council has been more of an advisory capacity. You know, we develop materials first, for example, and then they look over it and give really helpful, insightful feedback. But, you know, wanting to shift away from that and having more of a proactive role in which they can share in decision making with us, with other community and systems leaders at the same table. So this is very much a learning. We haven't figured out how to do that. We're actually very much in that process. And I think that's what's really exciting in terms of what's to come.
We actually haven't even we were having our first combined meeting in July. We had a meeting last week with both groups coming together, but more of like a highlight of what we were presenting today and sharing the latest learning and getting that information out. But our first official, like we're a combined leadership group, will happen in July. So we're right on the edge of starting that. And I mentioned in the talking points, like we have had conversations around what does this mean about decision rights and who makes the final call? You know, historically, it's largely been First 5 LA, right? We've been leading and holding and moving this investment. And then we've had, you know, some exciting, challenging conversations with DPH when we're like, when does First 5 LA make the call? When does DPH make the call? When do we have a joint, you know, consensus building and agreement on decisions? And so now we're figuring that out with our leadership council, with parents and system leaders together. So we're right at the front of it, and we'll love to share how that goes and what we figure out along the way. But yes, it's happening. And that was really a big aha moment last year as we were looking at the advisory councils and really realizing, you know, we were talking a lot about sharing power with parents, but we weren't necessarily doing it in our work yet. And so it was an understanding of like, why are these groups separate? We need to be bringing them together. What would that look like? And having the conversations with both groups to figure that out.
Commissioner Tilton, did you want to say something?
Yes. Thank you. Excellent information and terrific presentations. Thank you so much. You mentioned that 91% of the families calling in were 0 to 5. Can you kind of break that down? How many zeros are there compared to 5-year-olds?
Great question. Yeah, thanks for the question. I don't have that breakdown, but I can provide it to you. I can do some, I can ask our data folks to further break that down. Yeah, we had 91% of those that received a referral. We're doing so for a child that was in that range. So, but I can provide that information.
I'm just very interested in how soon we're able to reach these. Again, 5 years old is very different from a newborn.
Yeah.
And that of course pulls us into the health system more than the school system or the preschool system. But how soon are we identifying them? And then again, very much related to Commissioner McCroskey's comments, what really does happen once we identify them? I mean, we identify at-risk newborns for child abuse based on substance talks, you know, positive talks or domestic violence, whatever. And then they're referred, we've identified them. We don't know what happens after that. We don't know where they're connected. And there are just a huge range of issues that cross over with all of what you're talking about. So, so anyway, again, if you can, you know, answer my question about the variant, the newborns and how fast and what we might want to try to do and increase that connection sooner, that would be great. All good work. Thank you.
I mean, I will say we put a lot of focus on 0 to 3 to get intentionally and partnered with regional centers and who serve, you know, through the Early Start program under 3. So it was very much the earlier is where we need to go. Children need to receive the developmental screening at the right age intervals under 3. Like we lose out on a critical moment in time. Where is my colleague Sharna? I'm doing this for you, but I believe it truly. There's a window and a critical moment of time, right? Under 3. And we lose that if we're not doing the early screening then. And so the reality is kids are often identified in kindergarten or later, right? We've lost out on that opportunity for early intervention. So that was always at the front of our thinking when we launched the work. Who are the partners and the systems that are serving children in that age group? We early on also talked about how do we go prenatal? How do we go even earlier to think about, you know, the associations between maternal depression and risk for developmental delays and whatnot. And I can't say we could probably do more. We haven't built enough relationships in the prenatal to space, although our home visiting investments do a ton of developmental screening, and we don't often highlight home visiting as our EII, early identification intervention work, because it's kind of in its own separate effort, but it does a ton around screening
important.
children early, prenatally, if not within those early 0 to 3 years, to services and support. So it's very much been focused on 0 to 3. It's been heavily focused on healthcare, as I mentioned, with an understanding that that's where we think developmental screening and linkage should occur in the pediatrician or medical care setting, with an understanding, yes, Commissioner Hager, that it isn't happening. Like, look at the stats. We're making progress. We're still only at 34%. You can talk to all the parents in the room and they'll likely say, I'd never got a developmental screening for my child. Nonetheless, that's where the policy change is happening. That's where the reimbursements are available. Like I said, through Prop 56. That's where now there's measurement requirements. You have to meet developmental screening within the first 3 years left. They now have a minimum performance level they have to reach. If they don't get that, there's sanctions and performance plans. So that's where the attention and the policy shifts are happening. So it aligned with, like, this is where we go, where we really need to push for that early screening and linkage to take place versus other systems that often serve children later. And so that was where our primary focus was.
Well, I have just one other question I have you maybe to think about. I think peer support is really critically important. I think that also is probably one of the primary ways to deal with the stigma attached to anything. I think all of us who are parents appreciate another parent telling us, oh, heck, I did that too,
Yeah.
and that kind of helps alleviate some of that. I think a certain amount of stigmas with some of this is probably a good thing. I have to excuse me for saying that. But I think peer support really alleviates one thing, like Deanne, in terms of if fighting child abuse. We know that parents that aren't isolated are less likely to abuse. So it's isolation that really contributes to that. And as I think we talked about last time we met, the idea of using targeted visitation for parents that are not able to comply or haven't complied with the fact that their child has been assessed as developmentally challenged, if the idea that they would also using home visitation, by using targeted home visitation, by identifying the families that need it the most, might be an interesting way to try to change the system so that we have a better level, of compliance. Are there any other comments?
I do have one more question. Given the adjustment for universal preschool, which lowers the age that a child can enroll in TK to younger and younger, so 3.5-year-olds will eventually be part of TK. How has the conversation shifted with SELPA? Since before this transition, a lot of the services were provided through the provider or through the regional center. How are we supporting SELPAs and educating them and then informing them that you're going to have these children who may not have been identified yet entering your preschool classes, which are now TK classes, and providing support there so that the conversation is different, because early childhood education is actually not being provided in those TK classrooms. I see it firsthand. And so behavioral challenges that are related to developmental delays may be responded to with punitive measures, which is even more harmful for students.
Yeah. It's a really good question. We have not had a ton of engagement with SELPAs, maybe very early on in some initial planning, but it's mostly been focused in like the healthcare delivery space and with regional centers, given their focus on early start and up to 3. But it's a good point of, like, now that schools are serving younger and younger, and here we are dealing and seeing, behaviors that are challenging to address, or the workforce isn't kind of prepared and ready to best address it. It's a really good reminder and something we can think about as we're continuing to think through our partnerships and where policy is shifting to better serve families, but also how we can better address EII needs.
I will add that this is also another area where systemic racism also shows up, right? In which, preschool expulsion rates are disproportionately higher for children of color, particularly Black and Brown children. And so definitely an area that calls our attention as we enter our equity planning work as well.
So I know that we have some public comments, so we probably should move in that direction in interest of time. So Linda, I think we have some virtual public comments.
That is correct. Confirming we do have virtual and in person, and we will begin with virtual first, since that was the first request that we received. And Felicia, you do have the floor.
Good afternoon. Thank you, everyone. And thank you, First 5 LA Board and Help Me Grow LA CFEC. My name is Felicia Ford, and I am a parent who is actually on the CFEC committee for Help Me Grow LA. And I'd like to say thank you, first off, to First 5 LA, because my daughter Faith is now 21 years old. We were part of Westside Children's Center, a demonstration impact grant, and it was the first time I really cut my teeth on like parent public service, as I would call it. The work that CFEC is doing is just amazing. It is the most inclusive space that I felt as a Black mom of a Black child and a Latino child in Los Angeles County that are both regional center clients. And it is a very challenging lifestyle, but it's also been very rewarding for me. And I just think that without long-term funding for opportunities like this, if we have to expand the 5 years to 7 or to 10, it's just a really good goal to have, because this work is so worthwhile. I will stop in the middle of my day to respond to emails, and I'm a very busy mom, but I will stop in the middle of my day to respond because the work is consistent. It is the most productive work I've ever done. The team is amazing. They make sure that we understand things, that we're heard, and that the work is going on. I wish that we had an opportunity like this when my daughter Faith was younger, because my regional center is Westside, and they were and are awesome. However, they cannot do it alone. And projects like this that coordinate effort and services and take all of these blind spots and these hidden spaces into account are just worth their weight in gold. And I could talk for 5 hours about this, but I'll stop because I have exactly 17 seconds. But thank you all for your work and your help in making this a more clear, equitable space for families in Los Angeles County. Thank you.
Thank you.
Thank you, Ms. Ford. And Areida Gauda, you are next. The floor is yours. Areida Gauda, you are up next for public comments.
Okay, can you hear me?
Yes, we can.
Okay. Hello, everyone. Thank you for allowing me to speak. I'm Rita Golden. I'm the parent of Johnny, a 29-year-old young man diagnosed with quadriplegia, cerebral palsy, and chronic medical illnesses. I also work at the Westside Family Resource and Empowerment Center that is part of the Westside Regional Center, and I'm also a member of the CFEC Council. Many years ago, my son received early start intervention services, and I cannot express the support and difference that brought into our lives, helping us become better parents and allowing us to give our son a better quality of life throughout his life. We were lucky that he was referred at 5 months old, but the reality is that not everyone is that lucky, and that is why I'm passionate about this and speak to you today. We still have lots of work to do, but together we are on a good path. The work that Help Me Grow Pathways and First 5 in partnership with other community programs have done are huge. Participating in CFEC Council, along many other professionals and parents, has been enlightening and a great opportunity to make a difference. We have been allowed to speak on behalf of families like our own and help give insight and our own professional and lived experience, which is crucial. The efforts and tools that have been launched were done taking into consideration all of the input we provided, like accessibility, language barriers, outreach, cultural sensitivity, being parent-centered, things that we've learned along the way that for me personally as a parent has been very helpful. The Regional Center intake portals and centralized access point center that have come out of this work have made a huge impact. It honestly is something I always envisioned. It is our responsibility to continue in committing time and efforts and money into these valuable tools. Through the Pathways grant, our own WRC has witnessed a positive change we've made since launching it. And I just want to give thanks to CFIC and the help that they've given us directly. Their staff has been wonderful in guiding us, and thank you for allowing us to speak today.
Thank you very much. I think you underscored the importance that you have access and that people take advantage of this service for sure.
Thank you, Ms. Galda. And Fran Goldfarb, you're up next and the floor is yours.
Thank you. Good afternoon, and thank you for this opportunity to provide input. I'm Fran Goldfarb. I'm an inaugural member of the CFIC. I was also the CDC Learn the Signs Act Early Ambassador to California from 2014 to 2022. But most importantly, I'm the parent of a now adult child who started receiving regional center services at age 4. It is through these lenses, or juggling these hats, that I applaud the progress and the value of Help Me Grow LA. From its beginning, I had high hopes that Help Me Grow LA would not only be a valuable resource for families, but that it would incorporate parent voice and priorities into its very foundation. The Help Me Grow team, including both First 5 LA and LA County Department of Public Health, have consistently demonstrated a high commitment to the inclusion of families. Authentic partnership isn't easy to do, but consistently the Help Me Grow staff and volunteers have done the right thing rather than the easy or expedient thing. This has led to the development of a quality program. As I look to the future, I hope that First 5 LA continues its partnership in this valuable program. As Help Me Grow LA becomes more well-known and respected resource, the need will only get greater. Understanding child development and knowledge of community resources are critical protective factors that not only support children in their families, but support families in their communities. Help Me Grow LA has a primary role in that support. Thank you very much.
Thank you. I think we have one in-person public comment. Kathy, are you ready to go?
Yes. Okay. So, excuse me. So I'm Kathy Schreiner. Some of you know me, and mostly you know me from Best Start. But here I am now with Help Me Grow because I'm part of CFEC, so the Community Family and Engagement Council, and got that appointment because of my connection with Best Start, Region 3, and Panorama City and neighbors. It was an important thing for our parents to learn much more about early development and about early intervention, and we had a number of programs oriented to that. And, you know, we heard so much frustration from the parents about not being able to get the services that they needed and not knowing how to do that. And so when I heard about this program, and I had attended commission meetings for quite a while, so I immediately went up to Tara and I said, Tara, can Best Start Panorama City and neighbors be part of this? Can we be part of the pilot? Well, it turns out it's all so much more complex than that. But I do really appreciate this program because not only, as people here said, it's not just the screening, it's getting people matched up with the services, and that the services are delivered in a culturally sensitive way. And it's just, you know, it's such a huge problem, you know, nationwide, but certainly here in California. And so the Pathways is intended to try to create those regional networks. We haven't heard too much back about that, but I remain hopeful that that's, you know, a missing link that some of you have asked about. So then I was part of the group that helped to expand the membership of CFEC, and really proud of that because we really have much better representation now culturally, geographically, and we're up to 15. And one includes my colleague, Katja Morales from Best Start Panorama City and Neighbors, who is Spanish speaking and the first Spanish speaking member added to our group. So very, very proud that that's happening. But what's, you know, the challenge for us is that we have just, oh my goodness. All right, that we have just reached the beginning of our work, and here it is 5 years. And if we cannot get more time, to do the kind of work that we've been asked to do and to represent the parent voice and to give feedback to the system in different ways, then we will feel extremely frustrated. And I think you'll miss the benefit of the things that we could offer. So I hope that you'll consider that.
Thank you, Kathy. We're going to have a break at this time. I understand, 10 minutes break. So we should reconvene here. Is that correct?
That is correct. We will break for 10 minutes. And really quick, for those public members who haven't already signed in at the front, please do sign in so that we have your name for our records for today's meeting. That would be greatly appreciated. Thank you so much.
I'm going to just drink Diet Coke and have lunch. Have lunch. Well, I didn't because I was worried about my,
Leslie?
I'm putting on graduation. VIP.
Oh my gosh, yes.
I had to speak at faculty meeting.
Yes,
I still give him a hard time for abandoning us.
Come on.
Really good. I want to attribute that shushing to Linda, not to me.
Really bad.
Oh.
And John's not here.
Thank you very much. And thank you, Robert, for reappearing on the screen up there. I appreciate that. We're looking at a wonderful panel discussion at this time and looking at an update in building regional P2 movements and aligning network partners, something we were just talking about amongst ourselves here and how that's sometimes very difficult. So I'll leave this up to you to take it off. I'm sure you've all agreed to it. And Lee, I understand you can take the lead, so I'll leave it to you.
Start.
You'll start. Okay, good.
The leaders are right here. Yes, hi. Thank you, Commissioner Hager, and good afternoon, Commissioner, staff and guests. So we're really happy to be here. I am Lee Warbell, Director with the Communities team. And actually, the last time we were here with you was 2 years ago when we did a series of region by region deep dives. And we're happy to be back today with a different approach, a different format in this time of all sorts of news that we're experiencing and new ways that we want to engage with the board. We have a panel discussion that we're going to provide with representatives from our regional network grantees today. So it's going to be a full-on conversation. You'll hear examples from each of the regions, but you'll hear similarities and you'll hear themes across regions. So we're pretty excited about that. And I just wanted to say, I've been, as I mentioned earlier today, I've been with First 5 LA for 16 years, and it was a happy accident that got me here. I started in the grants management department, which is the department that monitored our contracts, projects, and grants, and quite quickly started working specifically on capacity building, community capacity building, and all that work that eventually evolved into what is Best Start. I have actually spent more than half of my time at First 5 LA with Best Start. And while I did not grow up in any of our Best Start communities, I am a very proud native of Los Angeles. And I come from a family of organizers, especially my mother. And there are lots of great stories there, but we'll have that for another time. I do have organizing experience, and that's primarily in the arts, AIDS, and LGBT communities. But that work and the heart of that work is what keeps me with Best Start and feeds me and feeds all of us. It's about centering community voice and really centering community action and activism and systems change and building community power. So we're really excited about this conversation. And first, I just want to introduce our speakers, starting with Joaquin Calderon, Deputy Director, and he's going to talk about the work, the evolution of Best Start, and moving forward. And then down at the other end of our table is Freddie Lee, who is a Senior Program Officer with Communities, and he's going to moderate our panel. And the panel includes Brenda Aguilera from Para Los Niños Region 1. Next to her is Dr. Michelle Burton from Community Health Councils, Region 2, and then Mr. Rogelio Tabares from El Nido Family Service. I always get caught up on one, Region 3, and then Christina Hall of the Nonprofit Partnership, Region 4, and then Sylvia Scott, Children's Bureau, Region 5. So then we can go to the next slide. And really, let me take a breath because I'm so excited. As you all know me, a lot of nervous energy.
when we're looking at centering really this important and critical voice of community insight, experience, and connections. We're working with these 14 Best Start regions or geographies along with the 5 regions. And all that we're doing is alongside these networks of individuals and organizations, community members, and public systems, all to try and affect this policy and systems change at the local level, and really about improving outcomes for our youngest children who are the furthest away from equitable opportunities. That's what the work is about. So what we want to do today, again, is to share some learnings across the regions and individual regions and impact that we are experiencing. I just want to take a moment before we start to just lift up a couple of theme areas that I think you'll hear about and that we find important to the work. And that is that about how these various networks and communities are identifying community priorities and transforming them into systems change. And it's really not about those community identified priorities and basic systems versus systems change. It's both. We also understand that those identified priorities don't always 100% align with First 5 LA's priorities. And that we find that is really, we need to understand that. And we also need to understand how really those identified priorities are critical to community. And when you look at areas like all that we've experienced with the COVID pandemic and other areas like housing and parks and public space, open spaces, and transportation, other areas of quality of life issues that families are facing every day. It's really important that we lift that up and be able to share that experience and understand how that might impact how we look at and how this work can help shape and inform our strategic plan reset moving forward. So, and then one last piece I just wanted to say is in terms of our evolving role, we continue to grow and grow more as convener, connector, catalyst, and advocate. And also thought partner. And we keep that in mind because our role as First 5 LA, oh, shoot, I thought my timing was. No, it's okay. It's okay. It's totally right. Anyway, let me just turn the mic over to Joaquin to get us going. Thank you.
Thank you, Ian. Good afternoon, commissioners. I'm now going to talk about the evolution of Best Start efforts, and we're going to start here with this photo of one of several events that First 5 LA hosted to recognize leaders in the Best Start communities. This photo is actually taken in 2014, and for me, it really sheds light on the level of commitment and pride of parents and residents across what we called then the 14 Best Start communities to advance a P2 agenda in their community and for their families. During this time, I was a program officer for the Broadway Manchester community located in South LA. And my job as a program officer at that time for the Broadway Manchester community was to manage a team of consultants to recruit and train a group of community members with a special emphasis on parents and caregivers to focus their collective efforts to call attention to First 5 LA's 4 goals at the time for families and communities in LA County. We referred to these groups as partnerships. These are the groups that were being built in the 14 Best Start communities, and many of them developed a formal structure with leadership teams that helped to lead the partnership meetings. In this picture, I actually recognize 2 people, a mother and a daughter, and they're somewhere in the center there from the Broadway Manchester partnership. And that was, again, the partnership I was working for and as a First 5 LA program officer. And how they learned about the partnership really was they received a flyer at a pocket park that First 5 LA helped to fund and open back in 2012. And through that flyer, they learned about the partnership meetings and they became very much involved in the leadership structure. And here they're being honored. And you've heard about and I think I recognize some others in there that are from other communities that are still very much involved today. I was at an event last week and I saw somebody from the community that's in this picture. And it was just amazing to see how many are still very active today and very much deepening their networks across the region. You just heard Kathy in the public comment a second ago talking about the connection she's making with Help Me Grow. Last week, I met somebody who's on the leadership team, but also president of their neighborhood council. Another young man who came into Best Start because his dad was a leadership group member. Now he's on staff for one of our regional network grantees. And so you see just the generations of getting involved and the commitment there. And I imagine, a lot of the other people in this picture were recruited or found in similar ways across the 14 communities through efforts by First 5 LA to bring together parents with other community stakeholders to come together to share experiences, build upon strengths to achieve the dreams in their community. The next slide really shows what we refer today, when we talk about the 14 Best Start communities, we refer today as the Best Start regional networks. First 5 LA funds one regional network grantee, or RNG, which is our acronym there, per Best Start region. And that covers the 14 communities in LA County. And so 5 organizations referred to our region as our regional network grantees, they provide the implementation and leadership support in each region. In Region 1, as Lee mentioned, introducing everybody, we have Para los Niños. We call that the Central East region. Region 2 is our South LA region, and that's Community Health Councils as the RNG. In Region 3 is the San Fernando Valley. That's El Nido Family Centers as the RNG there. In 4, which is our port cities, that's the nonprofit partnership as our RNG. And then in 5, the Antelope Valley, that's Children's Bureau. Next slide, please. And I started to share the Best Start evolution a little earlier when I shared what I did as a program officer in the early years of Best Start to build a partnership structure in Broadway, Manchester. Working in 14 communities with different staff really allowed us to explore different approaches to centering community in the partnership development work. As partnerships strengthened leadership, looked for new ways to grow their base, gain more visibility and influence in the community, we began as staff to understand our role needed to change. So in 2018, the First 5 LA Board of Commissioners approved 5 regional network grantees. This was the result of a comprehensive procurement process that included authentic community decision-making, and which transitioned this capacity building effort into 5 regions consisting of the 14 geographic areas and supporting the emergence of regional and local networks of parents, residents, and other community leaders and organizational partners. This shift to networks recognized the critical role they play in developing, uplifting, and sustaining systems change. The RNGs manage regional work and the strategic progress of the local networks, along with contracted partners. In these first 2 years, in 2018, we learned a lot about the time and attention needed to ensure a successful transition. A lot of healing needed to happen. I mean, here we had been doing a lot of the work as the doer. We had the relationships. And then with the RNG structure, we needed to have time to really solidify that relationship. And a lot of time was needed for that. And the regional approach started to ask the partnerships to rethink their structure, to incorporate a vision now for building regional power. I mean, here they had thought about themselves as an individual community. Now we were talking regionally. How do we build more power and grow our networks? These networks help to strengthen an ecosystem to raise a community of healthy children. When COVID hit, this made it more difficult for families and communities to ensure their children would reach their full potential. The RNG structure allowed community partners to pivot quickly to the immediate needs and to utilize the base of leaders in place to strengthen networks through efforts to distribute food, diapers, computers, and other important resources to community members, including a space, right, through their regular community meetings, because oftentimes these are monthly, if not biweekly meetings. They continued now with a virtual platform in a lot of cases. But for a lot of families, this kept their connections going in a time during intense isolation. And so today and into the future, we are focusing on the role as staff, as Lee said, in terms of what we can do as an advocate, as a connector, a convener, and catalysts to help strengthen the networks that have been built and continue to expand. As a communities team, as staff, we look for opportunities now to activate new and strengthen existing networks in the regions to complement the work of the RNGs. We are regularly involved in work to inform partners and systems leaders about what we are learning from community-centered systems change work. I'm now going to shift to talking a little bit about our learnings, our key learnings with our impact. And this picture, and we are showing it with this picture of some of the many articles on the First 5 LA website. And there are many articles about the Best Start regions, but in this one, we wanted to highlight really the text, what the text in the boxes above each picture, which uplifts key impact areas of our work. The first picture about power sharing, we understand that community must be a part of making the decisions around funding, policies, and practices. This article offers an example of the democratic and participatory spaces that exist through Best Start to develop community priorities. And there are many examples of how these spaces had to transform to respond to the COVID-19 pandemic. And that's what this article talks more about. So I encourage you to go on the site and read about it, but you also have some great panelists here who are going to talk about the work that they've done around creating these kind of spaces. In supporting parent-driven movements, we are learning about the role parents and caregivers and residents play when at the center of driving systems change. In this story, like many we see coming out of the regions, is how community-led advocacy, boosted by training and guidance from First 5 LA and its partners, push through the red tape and the slow-moving wheels of government bureaucracy. And this is a great example, I think, in this article of how community health workers, because we're always trying to make those connections, right, with the community health workers of promotoras, but they were very influential in this work to implement a plan to address this particular community priority. And the third example highlights cultivating networks and why it's important to balance both direct services and systems change. Here we are offered a great example of the support First 5 LA provided to bolster the quality of life for families and children through community-led projects that increase parks and open space, food security, and transportation access. And next slide, please. These are just a few of the examples of many that are helping us understand the learnings of our impact around systems change and the power building that's important to this work. Central are parents and caregivers and residents to driving systems change. Continuing to center parents and caregivers and residents allows us to respond to community needs. We saw the importance of this relationship during the COVID lockdowns and how quickly RNGs were able to pivot based on community feedback. Systems change is holding the current reality that families are facing as well as the vision for the future. In cultivating networks, we have to embrace both roles of addressing long-term systems outcomes and the needs of families. The pandemic showed us how important it was to have strong networks in place, both to understand the changing needs and to respond to them. During the pandemic, when Best Start Regional Networks distributed food, many used it as an opportunity to engage and recruit new families into the Best Start network. In power sharing, I shared a little bit about the participatory and democratic processes community members went through to develop a set of priorities to focus on. This is the case in all of our regions, where spaces are being created for community to make decisions around funding, policies, and practices. As the work with the RNGs continue, we are hearing from them about the bridges First 5 LA can build between systems and communities. We are committed to building networks across multiple sectors and with new partners. We are also focused on where there is alignment across regions to support the building of a countywide movement focused on P2 issues. As networks grow, so will the opportunities to help and support families. And as we think about sustainability, we understand how this needs to be different for each, with each community determining what will be sustained. As we think about the bridge building I just talked about, our RNG partners have different asks of First 5 LA about what bridges can be built by First 5 LA to support systems change driven by communities. Our current structure allows us the flexibility to understand and support different needs. And I think this is an important relationship as we think about our strategic plan reset process. Alignment takes a lot of time. And we've been doing this for a while, trying to create alignment at the community level. And I think you'll hear from our panelists that there's been a lot of success in that area. And so how do we think about those spaces where the community members are coming together, have these structures, are very much aligned to help support us in terms of our reset. I want to now turn it over to my colleague, Freddie Lee, to help us guide us in a conversation with our RNG partners to add their insights into the learnings about our impact and some examples from their regions.
Thank you, Joaquin. Good afternoon, commissioners. My name is Alfredo, but you're welcome to call me Freddie. It's a pleasure to be here with you this afternoon and with our colleagues here. So in preparing for this panel, I was like, wow, I had a lot of feelings. I've been with this work for 12 years. I have been in a lot of roles, seen a lot of meetings, thousands and thousands of hours in the community. So what I wanted to share is just the big moment this is for me to be able to share this work and to share this space with these folks who are not just representatives, but who are systems change practitioners in this new way that's evolving because of the work. So I'm really excited to open that conversation up with you all. My unique task is to give you 35 minutes worth of a lot. So we are going to just give you a taste and hopefully you'll get a sense of the great work that's happening, and it will spark more curiosity for further conversation. But with further ado, I'm gonna just open up the conversation. Oh, I'm doing this too. Our folks will introduce themselves as they speak, but we're gonna use these 4 questions as a frame for the conversation. And so we'll be exploring it together to help you get a sense of a nuance and texture of what's happening. Then we will have a chance for a Q&A as well. So let's get started. Can you all help me understand what the network work looks like? How has it been used to advance community-driven change? Anybody can kick us off.
I'll go. You know, in the Antelope Valley, we obviously we're seen, you know, categorized as a rural community. And so one of the things that we see, you know, we could talk about a lot of the disparities and a lot of like the things that are not getting to the Antelope Valley, because by the time it gets out there, it's already, you know, been dispersed everywhere else. But one thing about the Antelope Valley is that it is a valley, a community of very resilient people. We saw with the pandemic that there was a lot of the high numbers, right, that were affecting our communities and our communities of color. And so one of those things that we said, we were having a conversation earlier about that. We were talking about how the pandemic really affected our community and what came out of that. And what we saw in the Antelope Valley, we saw not only resiliency from the community, we saw networks of growing where there was partnerships that had never been there before. There was people who were providing work, but it was in silos, and we were trying to do the same kind of work, but just separate. So what we decided, we were also looking at Best Start, and we said, what is missing? What is happening? How are we going to make something good out of this? So one of the things that we saw was that even our leadership at that point was a little bit stagnant. So what we said is, let's infuse new life into this. We didn't come out to empower people because our community already has a lot of power. So we need to invigorate our community. And we said, we're not just going to sit here and we're just not just going to allow the pandemic to squash us. So what we did is we found new leaders, people that are assets in our community that hadn't really had their voice heard. And we decided that we were going to start doing things a little bit different. We were going to start really bringing in more voices, really bringing in the thought of rural community engagement. And what did that look like? The communities getting together and not just providing, like Joaquin said, you know, supplies or things that were needed, but really how were we going to, as a community and as a network, how we were going to support each other to keep moving. And so we saw a lot of work coming together. We did see a lot of assistance in utilities, assistance with food. We saw just it like growth in terms of community members saying, that's okay. I'm going to cook 200 burritos, or we're going to, go around and help the homeless families, because we saw more of that happening too. We had a lot of homeless families living in some of these hotels that were just not the best of conditions. So what did we need to do? We needed to come together as a network and really make some changes. So these are just a few of the things how that show some of the work and some of the community driven that work that and change, because I think the Antelope Valley looks at systems change as we are going to come and we are going to disrupt systems. We are not just going to come knocking at the door. We are disrupting to make some changes and to change some of the disparities and some of the oppression that is there. And it affects all our regions. That isn't just the Antelope Valley. So that's kind of a little bit of how we did some of that.
That's really exciting. I love how you highlighted different levels of work, right? Community systems, all of it. That's part of the network. Wondering if folks are, sitting with something you want to share around as we explore this concept of networks and community, things we want to share.
Okay, we had a learning. One of the things that we learned, we have these really powerful and strong community leaders that are doing so much work and advocating for so much. We found that some of our network organizations were a little uncomfortable or weren't really sure how to partner in that way. As organizations, we have our own strategic plans, we have our missions. How are we incorporating community members, community voice in a truly impactful and meaningful way? And so we put together a learning community with our network organizations, and through, doing all the things that we had to do in COVID, we also had this learning community where our network organizations wanted to be a part of it and saw value with the Best Start Community Partnership. They saw value in having community members, but how could they strengthen their internal capacity to better work with community members? And I think that was really powerful, because that in and of itself is shifting systems in how they're interacting with the community as well.
Yeah, this is interesting. Like, curious just to me, stay on this point for others, just how has that matured over time, like this relationship between orgs and how they do their work in partnership with residents? Can we just stay with that a little bit?
I can speak to that. No, Rogelio, you were getting ready to change the topic on us. Okay, so that really centers for me what one of our biggest learnings has been, which is focusing on building resident community agency. And in that transition, when we came on as an RNG in 2018, a lot of the leadership, as Joaquin mentioned, was really centered around building these relationships with organizations who are then building relationships with residents or training them on, how to actively participate in, systems change or just community activities at that point, and having a voice around their children and their families. We tried that for a little while. And what we found was, as is usual, from a systems change perspective on that sort of micro level, was that these agencies were having a very difficult time kind of releasing their autonomy as it related to how we were working with community members and residents. And so it wasn't an easy process, but over time we really, shifted their roles. So really, we have a resident elected regional task force, and they make all the decisions. We were very intentional in not having any seats on that task force that belonged to organizations. So all of that participatory grant making that we're doing around the community change agendas and the program we have around South LA Decides that we've built. And I'm just going to pass these out so that folks can take a look at this and have an example of, I think, all of the work that folks are doing across the regions. This is just one example of how we're engaging communities. And because we are talking about children 0 to 5, I brought stickers. You can fight over them as there's only a few. And I'm wearing my I Have Voted sticker. But this is how it has culminated, right? So now we do a community-wide vote. We started this in 2021 in the middle of COVID. We were able to get 555 votes. For those of you commissioners who were around when we first reported on this campaign, we're now in the second round of South LA Decides. It ends on May 3rd, and we're already at approximately 1,000 votes. We're very excited about that. But the key difference here is I have more residents than staff who are out there collecting these votes this year, right? So we had to start, set the example, work with people. We also didn't want to put residents at risk by saying, hey, we really need you to do this. So as staff, we shouldered much of that load in 2021. But this year, we're just trying to stay out of their way. They are calling us, they are giving us our orders. And actually, the young man that Joaquin referenced earlier, who's now a staff member with us, he reported the other day that his mom and dad, his dad is on the regional task force for the last couple of years and has now transitioned his leadership and is mentoring the resident that took his seat. He and his wife went out and collected 142 votes in one day. And we're very proud of that. And so that's just an example of how we have, I think, successfully shifted what was largely an organizational sort of led effort in South LA to a very much resident-led, resident-driven role. Now, organizations still have a role as grantees, but they are very accountable to our residents, and that is still in the works. I find organizations are a little bit contentious about being accountable to residents. And so we're working to build those bridges so that they see, the residents and the regional task force members as their partners, and that they respect, their voices and their opinions, in how they are conducting their programs, in the development of their evaluation plans, their budgets, as well as their goals and objectives around any community change dollars that they're using. So I'll stop there.
This is very energized for me. Maybe you were going to step into this conversation about accountability for the organizations and the residents. I was actually going to ask you maybe, but feel free to step in.
Hello, everyone. Brenda Aguilera with Para los Niños. So we have a pretty we started as the organization, the backbone, back in 2009 with Best Start Metro LA, which was First 5 LA's pilot community. And since then, we're really lucky to be able to develop what we're calling our community transformation model. And that really helped us develop clear policies and practices on how to ensure that the residents that we're working with and they're most impacted by systemic barriers are at the helm. So that it articulated everything from values, guiding principles and values that in operations. So when we talked about how to really center all of the efforts around the lives of those that are most impacted by barriers, we had clearly articulated what that would look like on the ground. It was really important to also ensure that the organizations that are serving these communities were at the table as well, because it's really important to create authentic partnerships and make sure that they were communicating with one another to have a real understanding of what the experience was on the ground. But at that time, I think we were able to bring in about 3 residents, and it wasn't until we hired full-time promotoras that within a year we were able to see the shift from 3 residents to 100, and then 100 more each year.
Could you give a timeline on this?
Yeah, so that was between 2011, 2012. That's when we started to see that huge increase. And then we ran into a resource issue because then these residents were meeting on a weekly basis. We developed what we call neighborhood leadership groups. One of the things that we wanted to ensure is that, at times you have these governance bodies that could seem very abstract. So it was really important to center governance and decision-making at a local level. So that was one of the requirements from the residents, that they wanted to make sure that we brought those spaces into the communities that they were at to make it accessible. But we were very strategic in ensuring that there was alignment between all neighborhood leadership groups and along with the organizations that they were partnering with. So the bylaws include everything from like ensuring that none of the decisions, all decisions had to be approved by 50% plus one residents. It's like one method to ensure that that we were in alignment again to those agreements. But what's been really interesting in the way that we've even been able to ensure that everything was informed and led by the residents is that all of the conversations and anything that we're strategizing around, it always starts at the level with the residents at the beginning. They have their individual space at a neighborhood level. They have a parent task force where they all come together to share what they're learned. Because with 8 neighborhood leadership groups, you'll have 500 residents, you have a lot of different perspectives, but they have a process where they come to agreements. Whether they may disagree on something, some of them may have other priorities, but they come to agreements on how they're going to prioritize. And then the organizations are paying attention and they're listening to these stories, and they understand that maybe the decisions that they would have leaned on, it shifts because they're learning about what it's really like on the ground. And at that point, they vote in agreement, typically, where with the majority of the residents want to.
I want to come back to this, but wanted to open up, Mr. Torres, because I think just this theme of accountability of the orgs and community, I think in the Valley, there's a very, I won't call it a unique approach, but I call it a beautiful approach around this healing work that you do. Could you maybe connect that for us a little bit?
Yes, I think it resonates with what Michelle suggested about a shift in paradigm. We found that we look at models, and we have a system that has been established for quite a while. If we look at ancestral traditions, rather than use the term model, I would prefer to use the concept of traditions. We have customs, traditions, beliefs, and it's based on, I think, the idea of the community being too heavy for one individual, for one church, for one agency, for one hospital, for one school. And in fact, before we started our discussion, I think it was Commissioner Hager that suggested the notion of collaboration, the need for collaboration. The experts tell us that this work in the community requires an interdisciplinary approach. The elders tell us that if you have a collective wound, if you're facing adversity, and it's causing a collective wound, you heal collectively. You come together. It's not individual work. And so our ancestors were experts in observation. They observed, they measured, they predict with the purpose of thriving. And they realized that in nature, all living organisms are programmed to grow, to learn, and to thrive. So that's been the basis. Our program is value driven, and we're borrowing from the Lakota tradition of shared well-being. And what that means is essentially we're looking at a process that focuses on interconnection, interdependence, reciprocity, and proper relations. And then shared well-being clearly indicates that resources are shared, knowledge is shared, wealth in terms of skills is shared, and power is shared. So this is the approach, Freddie, that we've taken in the Valley, and it's really resonated because it's completely driven by community, because it's their belief system, it's their traditions. We're not imposing a model from outside. We're asking them the questions, what do you need in order to heal? What do you need in order to recover? Because what we realized with COVID is that the state did not have a recovery plan. LAUSD did not have a recovery plan. They had a plan that necessitated reacting. It was a reaction plan, and it had to do with safety issues, but it didn't have the element of really recovering. And by recovering, I'm referring to a wound that is a soul wound. It's not a cognitive issue. It's not a physical issue. It has to do with the soul wound. And that's what we're focusing on, is trying to help the community to heal.
Thank you. I would love to stay on that all day, and I'm sure many of you would also. But I want to, we're touched on COVID a little bit, and we got to look under the hood a little bit on the theory, the practice. I want to talk more concretely about what some of the learnings have been during COVID and being able, and we started a little bit of on that with Sylvia. And just wanted to come back to that a little bit, just to maybe add a few more examples or of how, because of this cultivation that's been happening, right? This alignment of intention, or this sense of like broader commitment, what's been emerging, how have we been able to respond? Joaquin talked about alignment, right? Anyway, anybody speak on that a little bit in terms of COVID?
I could say really briefly on the flyers I passed around, you'll see there is the address of 3 churches across South LA. And so what we have done is formed relationships with the churches across our communities, and we are calling them our sustainability hubs. That is in response to, the COVID pandemic and ongoing crises, whether it's going to be climate change or food shortages, take your pick. So through these sustainability hubs, we are leveraging other resources, which is also a part of our sustainability plan in general, to, involve city, county, and other foundations in the conversation around how to better outfit these hubs, all the way from renovations and new constructions. We've been looking at real estate plans and footprints of each of these churches to see what their capacity is. We've been meeting with the families that own these parcels and seeing how we can better invest in them and in the resource they have, especially in the midst of rapid displacement because of hyper gentrification of our communities. And so that is, definitely things that we thought about, but COVID accelerated those plans for us and how we were working. And, really it's about coming back to models of community. Right. And I can hear Rogelio now. I'm like, traditions. And I often use Black Panther and the Brown Berets as that example, right? It's not about asking people to come to a meeting, but it's really about meeting people where they're at. Clearly they need food, they need diapers, they need shelter, they need mental health, they need their utilities paid, they need to know that they're not going to lose their home soon. So once we're able to address all those issues as much as we can through our community navigators who are working out of each of these locations, then we can get to the part about, hey, would you like to become a South LA Decides delegate? We have a community organizing and, civic engagement program that you can participate in, and you can get an accredited college certificate. You can get $100, grocery card, and we're going to forever, be a part of your network and, grow together. So it really is about meeting people in community where they're at and recognizing as a 16-year-old of the LA riots, nobody's coming to save us. Right? When things are on fire and there's problems occurring, the reality is nobody's coming to save us. There's a reaction plan. There's no recovery plan. Rogelio said that very well. And so what we're trying to focus on is how do we build these hubs within communities so that people can take care of each other.
I love that. And just to bring it back to make it explicit for folks here, the organizing around child development, all of it happens inside of this work, right? I think you all have seen, but I can maybe someone speak more on that. Like, we're organizing folks about lived conditions, and then at the same time, there's also a lot of development. And something I will say to everybody, I think all of LA County, every socioeconomic neighborhood needs to learn more about child development. And so that isn't an issue that you've heard here. Oh, people don't know. It's about stability of housing, resources, and things like that. So I just wanted to tie that in. Sometimes we don't do that neatly, but young children are central, but when we're engaging families, these are the realities that are lived.
Well, and
Either or.
No.
As we talk about COVID, we also saw that there was so much other issues happening, right? We had some of the racial disturbances that were happening. And one of the things that we found is that we weren't, as a Best Start community in the Antelope Valley, we missed an opportunity for a conversation. But this missed opportunity brought so much more other amazing projects and work to the community. So we knew, and in talking to the community, that it was said we need the, diversity, equity, and inclusion type courses or for capacity building. So we brought that in. Within the first 6 months of doing this, we had over 600 community members attend 6 classes, and they were monthly classes, but we saw that there was a need. And what we were doing is that we even, not just as the Best Start staff or team, we as a community were looking for tools for our toolkit. Why? Because we needed to have tools to have better conversations. We needed to have tools to be able to coexist in the same community. We also needed tools addressing trauma, because all of these issues that were happening, including the pandemic, was causing so much trauma. So we brought in and we started a trauma-informed masterclass, which really led from learning about ACEs all the way to how it affects the workplace, how it affects the adult and everything. We know that childhood experiences really affect our who we become as adults. So we knew we needed to have this. So we started this masterclass, and that in itself, we've already finished the third cohort, and there's still a demand in the community to do this, both for the DEI courses and the trauma-informed masterclass. And what the bigger picture is that we needed to go have those basic tool sharing, information sharing, so that now we can be at different places, and wherever we can go, we can have some of these conversations. These conversations aren't easy. These conversations shed a lot of light on a lot of stuff that is wrong, or that we're seeing, that's the oppression, the racism. But now our community is having they're being able to make better informed decisions on where Best Start wants to do some of the work and how we want to interact with the rest of our community. So I think that's just one of our biggest learned experiences, I think, through COVID and with all of that.
Yeah, what I'm getting a lot is the sense of process as part of healing and power building, right? There's this slowness that we talked about during lunch that is necessary. Did you want to add, Chris?
Yeah, I do. I'm glad I let you go first because I can build on that. In that, what we saw in 2020, we saw this enormous need that developed around all the things that have already been shared here, like food and diapers and formula and all these things that became unavailable to all of us in the community. But in our Best Start neighborhoods and Best Start communities, it was even rougher and tougher. There was so much price gouging going on. And our leaders, our community members that are experiencing this stepped up. First 5 LA gave us some flexibility in how to be able to respond with our community change funds. And they utilize community change funds to help with those direct. We had community members walking to other community members' houses who were homebound, like couldn't leave because of what we didn't know about COVID at the time. We had other community members that were advocating to LA County because there was no COVID testing or COVID vaccines when that happened in Wilmington. And because of that advocacy and having a partnership with our local network contractor in Wilmington, they were able to bring that in to the community. And at the same time, they didn't stop working on systems change issues. We had in 2020, we had a participatory budgeting process. Our leaders insisted on continuing it. And in fact, they led the only participatory budgeting process in North America that happened in 2020. And they moved it online, and they funded projects that they needed in the community to address their priority areas, their community change priorities, so that their children could thrive.
And at the same time, you saw one of the pictures that Joaquin shared. Our community members in Wilmington, our promotoras, they got a decorative crosswalk put in to change pedestrian safety in the community. And so at the same time, they were solving direct service needs that no one else was solving and systems change needs, and just kept going, even though they themselves were being so hugely impacted by the pandemic. And I just, I thank First 5 LA for giving us that flexibility, but the leaders, they did it. They are the ones that did it.
Thank you, Christina. I want to stay on this, kind of zoomed out a bit around this systems change. Like, what are we seeing? What's working? What are we beginning to really get excited about that we want to keep nourishing, keep growing in terms of these changes, right? These examples of both and, right? It isn't a dichotomy. There's something that we're finding here.
If that's okay, I
Yeah,
could share about how our work is expanding with through a partnership with Children's Hospital of Los Angeles. Right before the pandemic, we were meeting with their Department of Social Services. They had seen the work on the ground, especially with the neighborhood leadership groups, and I think they were already doing an assessment to understand why families in the spas that they serve were having difficulty accessing the hospital. A lot of the families that they're working with have children that have chronic health issues. It's a large population of immigrant communities. There's literacy challenges, just access in general to basic needs is real. So they were really interested in learning more about the promotora model, especially because they had seen how the promotoras are building the capacity of residents to lead all of these efforts. They were just serving there as coaches, as the systems change efforts. So we developed a partnership so that they could hire 4 residents from the Best Start Partnership, because they had already gone through the community transformation leadership training for a number of years. And obviously they also understood that the residents had the cultural competence and the fluency to be able to navigate the gaps in these systems. So they brought them on board, and part of the work was to work directly with social workers to see, to understand why the families weren't accessing those resources. I think at the time their data showed that it was anywhere from 10 to 20% of the families that they were trying to connect. And I'm talking about families who couldn't make doctor's appointments. I mean, the previous presentation reminded me of that. There were families that couldn't attend their doctor's appointments because they didn't have transportation. They had to work. They weren't giving time off to make appointments. They could lose their jobs if they miss appointments. They couldn't, they had to prioritize resources, even just to think about food and safety and other basic needs. So the social work team was responsible for helping to connect them with those basic needs. And again, there were only about 10 to 20% of those families were connecting to those resources. The moment the promotoras came in, within 6 months, we saw a large increase. And at this, I think the number went up within 6 months to about 60% of the families are connecting to these concrete supports. And 2-3 years now, they're at 88%. We understand by seeing the assessments that we've disseminated right now with the work that Best Start is doing. We understand that housing is a priority, and it's impossible to find housing. It's impossible to find those resources. The CHLA families are also experiencing those same challenges. So it's one of the highest needs that they have. They're being displaced. They're at risk of being displaced. A lot of the supports for renters have been eliminated. We're not sure what the impact we're going to start to see the impact of that in the coming months. At least 80% of the population that we're working with are renters. So we're going to just experience the communities that we're working with are going to experience like a bigger crisis at this moment. So we know that the referral numbers could increase, but the reality is there aren't any opportunities for housing. So I think this is an area that Best Start Region 1, which also includes East Los Angeles, Metro Los Angeles, South El Monte, and Southeast LA is focused on at this moment. So they've decided 2 years ago to primarily focus on policy and systems change around this effort.
I'm very excited to hear more. So again, my task is to give you a glimpse. So I'm going to close out the panel, maybe start with Sylvia. Just a sentence, what's exciting you the most around opportunities in this work?
Renewed hope in the community.
The community feeling that? That's awesome. Yeah, thanks.
I think our community has been going back in person for meetings and just it's reinvigorated everyone. I think that group reinvigoration.
I think I consider the outcomes, the successes that we've experienced that are very tangible. We saw in our community that there was an attempt to bring in a detention facility in Arleta for detained immigrant children. And I think that violates all of our moral principles here in this room. And I was appalled that in my own discipline, the American Psychological Association took no position on this. Children were put into cages. The American Psychiatric Association took no position. The National Association of Social Workers did not take a position. The Department of Children and Family Services did not take a position. The community did take a position. There was a protest. Our representatives were solicited, and the detention center was built somewhere else. That was a success. In terms of the farm workers, that's an ongoing struggle. We kind of the community pressured the governor to sign into law protection for the farm workers in terms of voting rights. That was another accomplishment. And what I'm really excited about, Freddie, what gets me up in the morning and motivates me to go into the office and to do my work is that we were granted by the city. We were awarded the opportunity to create 2 healing centers in the San Fernando Valley. So this is offering alternative curative options for the community in lieu of a 5 to 6 month waiting period for the Department of Mental Health to be seen for services. And then we know for a fact, it's well documented, that families of color, communities of color that do access the system and are able to get an appointment, they terminate prematurely after 3 to 4 sessions. So we're making an impact, and that's tremendously motivating for me.
Yes, I think in sound bites, we are most excited about our Guaranteed Basic Income Initiative. We are one of the few organizations that's not a municipality that is implementing a Guaranteed Basic Income Initiative, and looking forward to submitting to the Independent Review Board so that it will be a IRB study, and we will be publishing on that, mostly to evidence that it's going to take more than money to fix, what has been broken through, just hundreds of years of harm that's been done. And so a Guaranteed Basic Income Initiative cannot just be about sort of, the approach that many of the other initiatives have taken, which is traditional science, where you just sort of throw, money at folks, and then you stand back and you observe them and see what they do with it. Rather, there's lots of data out there now. And so we're taking the approach with our partners and researchers at USC to really focus on the wraparound supports that we want to provide, and how those wraparound supports are just as critical to improving outcomes for families as is the, cash resources that are going to be provided to them. So we're extremely excited about that, and continuing to provide and build the infrastructure for a 99, if not 100% volunteer-led South LA Decides initiative that will supplant sort of the Best Start as we look year over year at the decreases in funding. We know that we're trying to build a network and an infrastructure that can live beyond us and not be reliant on outside funding. And that's going to take continued innovation and creativity from ourselves and our community members.
I think what excites us right now is the ability, we've been growing as a team thanks to the involvement of the work. So right now we have we're growing to a team of 25, and 16 of those positions are held by former Best Start residents. And that's everything from the promotora positions, administrators, coordinators, and managers. We're really proud to see how we've evolved thanks to this investment. Our organization has also evolved. We have promotoras and other key positions across the organization. And now with the partnership with folks like Children's Hospital Los Angeles, Cedar Sinai actually invested. They give us a grant to expand that work and to also support other public health institutions in adopting the model. So it's a pivotal time, I think, for all of the residents. Honestly, it's thanks to their commitment, their drive, their will, their trust in us to work alongside us for all of these years and to really shape the direction of this work and all of us. So we're really thankful to them, and we're still looking forward to see where it takes us in the coming years.
Thank you, Brenda. And thank you, esteemed panel. Thank you for trusting me. Thank you, folks. I'm going to hand it over to Joaquin for a summary, and then we'll have a chance for more discussion.
Yeah, I know people probably want to jump right into, thank you. Thanks, the panel. We want to have time for you all to ask questions. Just wanted to end with this. So what's next? Where do we go from here? And often when we talk about systems change and changing the mega large systems agencies serving LA County, we ask, where does systems change actually start? And I hope today, it's clear that it starts locally with community. Building community power is ongoing and dynamic, and we are learning to effectively adapt our roles to address the changing needs we, First 5 LA staff, come in contact with. And it's causing us to become more engaged in connecting, aligning, and sitting at various network spaces to support an expansive understanding of the region and to support the Best Start network to affect systems change, to help improve outcomes for children and families. So today was about making these connections and weaving a story through our learnings and examples of impact. I'd like to open it up for questions and reflections from the committee.
And we have a set of suggested questions to think about. We really want to hear from you all in terms of what resonated and what else you would like more to learn about centering parent and resident voices and cultivating networks. And then also especially how you see this Best Start investment really helping to inform and shape the goals, objectives, strategies, and for the strategic plan reset, and any other questions you may have or reflections. And it's sort of freewheeling if there's any specific questions or.
Commissioner McBride would like to ask you a question.
Yes, thank you for this presentation. I'm learning a lot about Best Start, but I am familiar with some of your. And even though I guess one of the tenets of Best Start is to focus on the community because you're in different geographical locations and your demographics and your community dynamics are different. Some of the challenges obviously overlap. Is there sort of a landing pad of best practices, like some of the things you've shared today, learning networks, resident elected task forces, the sustainability hubs? Like, is there a landing pad where you all share these best practices that you found worked in your communities that may work in other communities?
I think that goes right to Freddie.
So we do our best to try to connect folks regularly in learning spaces. There's a lot of demand, but we have a learning community of practice. And then our sort of formal, it's not an evaluation, but it's sort of in that realm, is the Best Start Learning Agenda, which also is about tracking those themes. So we had a summit last week where we did explore some of those themes. And the idea, part of our strategies is what we call field building. So how are we helping build the field around these practices? Kind of like with several of the examples of how we do it and what is working. But we need help, right? To amplifying that voice.
Yeah, and some of the areas that are coming through and what we're looking at are themes that cultivating networks, building community power, and sustainability. I'm not remembering the third one, but I'm putting in sustainability. Are areas that are all being touched across, and we're all touching across all the regions. And so those are the conversations that are happening with the Best Start Learning Agenda and in the community of practice to really the community or communities of practice is really about building the practice of doing this work and strategizing together. So, yeah.
And I'll just add, I think how I started the presentation around our role as the doer, we were really involved in building the community partnerships. I think as we've been able to take a step back, and as you'll see, as we submit our budget for the next fiscal year, we're really thinking about how do we put resources in the hands of staff to really go out and share these best practices out in the community with other funders, with other partners. So we're planning to really take our show on the road, and that's going to be a real prime focus of our.
Thank you.
One of the things that I think is really important, we were talking about it before, is knowledge about what is there and what we can have access to. I mean, sometimes I find out about major funding sources for the community just accidentally, like rather than there's a knowledge so I can call Sylvia up and say, I know somebody who wants to do X in Antelope Valley. That's an important connection to make. And I think that's critically important. Oftentimes, the bureaucracy gets in the way of the individuals in the community. And I really am excited to hear about the community being involved and driving it, because I think the community is much more effective. I personally would always like to be a resource. I think that's one of the things that First Five would do. And I'm a commissioner, so I'm sitting here as First Five, but I'm also Astrid Hager, pediatrician. And I would also like to know that I would share with you what options come down that I hear about. So looking at creating a clearinghouse of knowledge of where resources are, where government funding is coming from, where other community funding opportunities are coming from. Because one of the things that I think happened with COVID was there was this tsunami of ennui, of boredom, or like, why get involved? And I'm surviving. And that's, the disinterest by many in those who needed their interest the most. And I think that we need to help each other regain that momentum. And one way of doing that is sharing information rather than holding on to it. So if you, speaking not as First Five, but if you talk to me afterwards, then let me know what I mean, like I have too much stuff sometimes, and it would be great to share it with the community who doesn't have. And, I'm a doctor and I live in a research institution that's focusing on things that the people you take care of and that I'm interested in are not worried about. They're worried about eating. They're worried about changing their kid's diaper, and they're worried about where they're going to sleep. They're not worried about stem cell research. That's a fact. And so how do we then connect those dots? I spent a lot of time in high desert over the years and watch it get weighed down by bureaucracy, and now reemerging because the community again is involved. So I really want to validate that, Sylvia. I think that's really important. So I think maybe at First Five, we can look at it as thinking about where resources are and creating a resource access vehicle so that we get, we're not in direct services here. I know we're really more into policy, et cetera, but maybe one of our policies should be that we know where the resources are. That's one of the things. Would that be helpful? I have a question.
Thank you so much for the panel. It was very inspirational. The work that you do is wonderful with community. My question is, how do you, once you have community input, how do you then share what you've learned with other agencies, government partners, school districts? How does that get communicated?
We, one of the things that we saw that there was a little bit of a disconnect between the actual residents and then some of our partners, community leaders. And so what we really strive to do was then create a forum, an area where they could, we'd all come together and bring this kind of information. So we do what we call our quarterly stakeholder convenings, and really the whole mission of these convenings is, one is to bring and present the work that the community is doing, but we're also emphasizing policy and data. The Antelope Valley is very thirsty for data. And so since we began doing that, our numbers grew both of residents and of other stakeholders, and wanting to be part of some of this. So that's one of the forums that we've provided. And then another project that we did, and thanks to Christina, give us this information. Their region had done a State of the Child report with who's now Catalyst California. And so we partnered with them as well. And the beauty of this project was that it was all the research and the areas that the research was going to be done on was really going to be driven by the community. And so we're almost done. We're almost at the nearing point of that. June, we'll be able to have our full State of the Child of the Antelope Valley report ready. But these are just some of the opportunities that we want to have where everybody can come around to share some of that information, the data, or even policy that's affecting our community.
We have another way that, on top of all this, I think we all have similar processes, but, you know, I spoke of our learning community, which helps us work with community organizations. Our community organizations meet with community members at community partnerships. So there's that joint sharing there as well. But in our region, we also have what's called a funders dialogue. And so we're able to share these learnings with other funders in the region so that there can be the creation of alignment around the community priorities. And by sharing those community priorities with other funders, you know, it's that sharing of knowledge, but is there a way to build connections and build alignment around funding models in our region to help strengthen the work that's being done by the community?
And just briefly, so as an example, with our Guaranteed Basic Income Initiative, back in 2020, we did the research and then had a Women, Wealth, and Equity Summit where we shared our Price of Motherhood study. And that study was done with 100 moms in South LA, asking them, what does your financial life look like, the impacts. But one of the biggest takeaways from that data was that they were on average short $443 a month to make ends meet. And so that data point informed our Guaranteed Basic Income Initiative, along with other data points that we landed on $500 a month will be the distribution for our moms on a bi-monthly basis, because getting cash infusions more frequently, data also told us that there was a higher likelihood of it being more useful to them, right, as opposed to once a month. And in correlation with that, we're in the middle of our ACEs study with 100 Black mothers in particular, given that they are disproportionately impacted by, infant and maternal health disparities. And so that particular study, we actually are up to 125 mothers. We've closed it, and now we're analyzing the data and doing some follow-up focus groups with providers and with the mothers that participated. But that data on adverse childhood experiences is also going to inform how we approach some of the work that we do with all mothers, in particular our Black mothers, during the GBI initiative, right? And looking at, these impacts and where the intersectionality is, right? So I think just always making sure that we're not taking any reductionist approaches to how we're looking at these problems and disparities, but continuing to look at, the research that we're collecting empirically, along with any other secondary sources, that have relevance to our communities.
I wanted to pick up on the first question there, what resonates with you? And one thing that I work for the Department of Public Health. We fund many, many community organizations, and we definitely experience that tension of organizations feeling like, fund us, we are the community, and feeling like, on the one hand, they are a terrific bridge to community residents, but they can also be a barrier when the money stops there. And how you overcame that. I mean, did you ultimately get buy-in for the idea that no, it has to go this next step to really reach residents? And, have you sort of been able to get the organizations that feel very passionately that they grew out of the community, they can speak for the community, they represent the community? How was that sort of barrier leapt, if you will, or is it still a challenge?
I think it started with the design for Best Start and putting residents at the center. And it's now, as we brought on board the regional network grantees and other partners, bringing organizations back into that full table. Originally, when Best Start started, it was about everybody at the table. And what we realized is we really needed to build or center residents and community members to really, what's the word you used? Invigorate that power and voice, and then realized, well, actually, there's more to a community than the residents. There's more to support that, and bringing the organizations into that fold, as opposed to starting with the organizations. So I think each of the panelists might have something to say about that on an ongoing basis, but it was built in.
I'd like to address that. I think one of the issues that we had was this illusion that there's a separation, there's a disconnect, no? Agencies and staff, and then residents or community. And I think that's one of the challenges that we had initially, was making it clear that we're part of the community. The staff and the agency, we're involved, we live in the community, we work in the community, we have our homes in the community, so we are part of the community. And we gather, I think, also to address Commissioner Ramirez's question as well. We have meetings on a monthly basis that bring community leaders, parent leaders together with agency representatives. And what is the focus? Healing. Because the providers, they're frontline people, but who heals the healers? So we come together and we collectively support one another. So we have opportunities for funding. We have now also what was referenced, I think, before, the participatory budget process, where the families, the residents come together and they work now collaboratively, co-creating with agencies services that are needed. They're not models that the agencies want to replicate or want to continue, but they have to come together and co-create based on the needs, identified priorities of the community. That's one. The other example is the promotor model, which is a very effective model. It really focuses on the medicine that's available in the community, which is knowledge and expertise of the leaders in the community. They're already respected and they know all the connections. So what we want to do is we want to elevate that position and give them dignity of a living wage and certainly benefits, because they're given a title. They're essential workers, but they're not treated as such. They're disposable workers, essentially. When you need them, you bring them on board. And when you no longer have a need for them, you get rid of them. So I think we're trying to elevate that, that position by providing them training to be marketable, to have skills, and to have dignity in terms of working.
Go ahead.
We also have what's known as Antelope Valley Resource Infusion, and it's a collaborative group of a lot of different partners within the Antelope Valley. But what they did is they looked at the whole Antelope Valley. They did a landscape assessment and found that there was 3 massive areas that had the highest need of even all of the rest of the Antelope Valley. And so what they decided to create was this resource group, collaborative group, and they based a lot of it on collective impact and bringing people together where they're organizing providers work groups, they're organizing resident work groups, all for those 3 different areas in Palmdale, Lancaster, and in Lake LA. And part of the big work here is that as we talked earlier, that some people just do some silo work and they're all doing the same work, but no one's talking to each other. And so a lot of what the AV Resource Infusion wants to do is bring all these different resources and be able to be out there to provide them, but also in between organizations, as we know that funding can come and go, we start leveraging what are some of our resources, and we start leveraging with some of the other groups or other strategies that are happening. So that's one way how, we try to keep the conversation happening in terms of sustainability.
I think we're almost out of time. Maybe correct me if I'm wrong.
That is correct. We have a few minutes left for this item.
Are there any other comments from the panel, or do we have any public comments?
If I could add, I think with our experience, it depends on, it's a great question because it has varied between when you're talking about subcontractors, maybe that we partner with, or organizations that join the partnership. It varies, I think, in their approach. Again, it goes back to us in the values, and how they operate those values. If they see a value in partnering with residents, it depends on how open they are to explore how they have to shift their practices. So if there's an openness to that, one of the things that our team talks to them about, it's we're going to do an onboarding about the theory, but I need you to come in to see it in practice, experience it, because I think it's a whole different approach into the way that you typically do this work. I think there's also assumptions that things have to slow down for residents, or that maybe what we're doing is too much. And it's interesting to see who challenges these notions. It's not the residents. They're comfortable with the complexity of drilling in. I think it's often the folks that have to challenge the way that they've probably have to practices that's when it becomes difficult. But I think it's really important to partner around those pieces. That it is about transforming as individuals in this work as well.
Thank you very much. And I don't know anybody else in the audience, but it was terribly inspiring to me to see the communities begin to rise up and take charge of their own community. It's always worried me that we dictated to communities what they should do, and it was usually wrong. And so it's wonderful to have you here, and thank you very much for coming. And Linda, were there any public comments?
Confirming there are no public comments for this item. And before we move on to the next item, I do want to make it known for the record that all materials that were distributed by Dr. Burton will be made available online on our website under our meeting materials so that they're accessible to all public members.
Thank you for that. I think we have one item left, which is item 7, which is the authorization of First 5 LA to receive funds from First 5 California. I think we're always willing to accept funds from First 5 California. I won't speak for anybody else here, but so I believe that Diana was to speak to that, or we.
This is a written only
okay.
item. There are some materials just to draw your attention in the board packet. There's a memo explaining the availability of these dollars from First 5 California, as well as what we would use them for, which is in partnership with our county partner, Department of Public Health, in order to build out what's called a data lake. So an ability to pool data across the different home visiting models so that we can better report on countywide data. And also to test out ways in which we could draw down the community health worker benefit out of Medi-Cal, which is a new way in which we can bill Medi-Cal for services provided by community health workers. And we feel there's great alignment to the home visiting staff that perform a lot of these functions. So it's testing that out so we're in a better position to pull down those Medi-Cal dollars. If there's any questions, Deanna is in the audience, or in the back to answer.
On the back there, okay.
Yep.
Thank you very much. I'm just, when it comes to money, obviously, the door is always open. And I want to again thank the panel for coming. Some of you came a ways, and I really appreciate that. And I want to welcome Summer McBride sitting at the table, I think, for the first time, correct? Yeah, as our new commissioner from Supervisory District 3. Yeah. 2? Is it 2? Oh. Okay. And I think with that, are there any other general comments about anything in the world, apparently?
Before we proceed to general comments, confirming that there are no public comments on item 7.
Oh, all right. So back here, it says for items not on the agenda. Whoa, that leaves the door wide open. Are there any public comments on items not on the agenda?
Confirming that there are no public comments for items that are not on the agenda.
Well, then I guess we can move for adjournment and go home for the day or back to High Desert, right? It's kind of a drive. And thank you so much for coming. I appreciate it. And Sylvia, maybe you can talk to me for a couple minutes before you go, or anybody else who wants to. I love this first 5. I love the commission. I love the fact that we're actually trying to do something rather than just talking about it. So thank you very, very much.
See you next time.
Yeah, really.
Whenever.
Thanks so much, Dr. Burr.